Hi, welcome to Pets and Vets. I'm your host, Eileen Arena, and this is Dr. Avi Shaprut.
Hi, Eileen.
Hi. Pets and Vets is a healthcare show providing you with information and tips about animal health care. During each show, we're going to head out to the veterinary hospital for a closer look at how your animals are cared for during their checkups, surgeries, and other veterinary treatments. We'll look at pre- and post-operative surgical procedures and routine care for your dogs and cats, birds, snakes, turtles, and lizards. We'll keep you informed of the most innovative and up-to-date practices in the field of animal health care and veterinary medicine. Right here on Pets and Vets. Today we're going to visit the veterinary hospital to watch Dr. Shaprut perform an ultrasound on a pregnant dog. Could you tell us a little about ultrasounds, Avi? I don't understand when you're looking at the ultrasound screen what it means. My physicians, when I have gone for ultrasounds, have tried to explain exactly what's on there, what they see, but I don't quite get it. So what do you see and what are you looking for?
Well, an ultrasound basically consists of three components. A TV screen, which is similar to a computer screen, a computer, and a transducer, which emits sound. The sound reflects off of different tissues in the abdomen or the chest, whatever you're ultrasounding, differently. And then it is received back into the transducer. The computer processes the information and produces an image on the computer screen, and that's what you see. Mm-hmm. As I said, different tissues reflect differently, so air will show up as bright or white on the screen. Fluid shows up black. Soft tissues, they'll have a mixture of the two, so they will show up gray. And different shades of gray help differentiate between different organs.
Okay, well, let's take a look and see how it's done.
This is Polly. She's a 7-year-old Australian Shepherd. And she has, we believe, some puppies in here. And she is about 7 weeks along. And what we're going to do right now is try and find these puppies, make sure their hearts are beating and that they're doing well. This is her 4th litter and probably her last. So what we're looking for here are some fetuses with beating hearts. And right there you can see a picture of a spine. That puppy is probably got either its back to us or its front to us, but it's facing us or away. You can't tell which on ultrasound because it's only a 2-dimensional image of a 3-dimensional object. Hinkle girl. What we're going to try and find is a beating heart here. You can see the ribs coming off of the spine. Easy girl. There's the heart coming in. I'll try and get a better picture. There it is. And we'll see if we can get some color Doppler on there. That's a way to measure flow of blood vessels. You can see the color there. Blue signifies blood going away from the transducer. Red is going towards the transducer. That helps us find abnormalities in animals with heart disease. Sometimes you can find congenital defects by having patent vessels that shouldn't be there, that normally would close off during development, either in the fetus or after birth. You can zoom in on that and get a better idea. You're starting to be able to see the chambers of the heart, which means she's probably somewhere, like I said, around 40 days or later. It starts around 40 days when you can see the chambers of the heart. So there's a good picture. We're starting to see the differentiation of the 4 chambers, the 2 ventricles and which are the pumping chambers, and the atria, which are the loading chambers of the heart. Start to lose some resolution as you zoom in on these, so Sometimes you have to use a little bit of imagination, but there you get a really good picture of the ventricles, the pumping chambers. That's a nice, strong, rapid heartbeat. So that puppy's doing well. We're going to cruise around, look for some more.
That was very interesting, Avi. What are you looking for in the heartbeat and the structure of the fetus? Possible birth defects?
Well, first we want to make sure that Polly's puppies all have steadily beating hearts. As a rule, they should be beating faster than the mother's heart. But at day 40, we should be able to see the 4 cardiac chambers, and at different stages of pregnancy, you'll be able to see the other structures, such as the limb buds, the fetal skeleton, and organs in the abdomen, such as the liver, the kidneys, the urinary bladder, the intestines. You should see a sample of that in the next segment. So we try to go around in a circular fashion. Ultrasound is not the most accurate way to get fetal number. It's a good way to assess the fetus's viability, how it's doing in the womb, but because, again, this is a two-dimensional tool, you can miss fetuses tucked up, they can be overlapping, you can count them twice. So we're going to just try and get an estimate. So we're looking for more fetuses. That looks like a second fetus right here. We're a little further down in the abdomen. There's another beating heart. I'll try and zoom in on that one too. Get a better look at it. There you get the blood flow. Here we're going to zoom. There again you can see the beating chambers, the pumping chambers, the ventricles. A nice steady heartbeat. You can see some calcification of the sternum and the spine. That's the bright spots. Bone shows up bright on ultrasound. Fluid shows up black. So you can see the fluid around, the black around the fetus. That's the sac, the fluid in the sac. So let's go looking for some more. We try not to clip these pregnant dogs because if we irritate their skin, then when the puppies are born, they may not want to let the puppies nurse, and we don't want that. So we just try and use some alcohol and some gel. Try not to clip much hair. That's our second one that we saw. Hey, good girl. Try not to miss any spots. This here may be the beginning of a third, but we'll see if we can get it in.
Okay, go.
That looks like a third one. I'm just trying to get a heartbeat. This one looks smaller than the other two. Yep, there we go. Just seeing some beating there. Try and get a better picture. There we go, another heart. Again, a nice rapid heart rate. Usually faster in the fetus than they are in the adult and even the postpartum puppy. Again, you can see that the spine is mineralizing, ribs are starting to form. this one looks good too. I'll keep looking from here. So far we're at 3. Along the way we're going to see her organs, Polly's organs, some section of that. We're not really going to focus too much on that, but little loops of bowel come in. Sometimes you see the spleen, parts of the liver, the kidneys. Right there we have some of her liver coming in. You're a good girl. See if we find another one tucked up in the front here. That's a kidney that's coming in. Not something we need. Certainly something she needs. Okay, what I'm going to do is we're going to go scanning in a grid pattern and see if we can pick up one that we haven't found so far. We found 3 of them. Kind of mentally remember the locations as we scan so we don't count them twice. So I'm going to start from where we started initially, and we're going to go across back and forth looking for ones we might have missed. You're a good girl. Easy, baby. So there's the part of the first one that we initially saw. We're going to just come across. No more babies up there. Go back. And there's another one. It's hard to tell sometimes how far the fetal sac stretches. Could be, since I'm at the middle, it could be part of the first one that we saw. But it's on the outside of what we would expect, so this might be another one. So we'll say this is 2 for right now. Looks here like that was a separate one. Easy girl. Here's back to another one. So that's 3. Again, a better way to determine the exact number here is definitely with an X-ray. You can count the little heads, even if they're laying on top or overlying one another. There certainly could be one more somewhere in between, or even one less. But after our scan we've been through twice now, pretty much assume that that's going to be our number until we can check with X-ray or until she has her puppies. And that's about it. Thank you, Polly.
Now, Polly's ultrasound came out, very well. The results were good. What if it hadn't? What would you have done?
Well, it depends on what stage of pregnancy Polly is in. In this case, we saw Polly at about 7 weeks of pregnancy. If she had had 1 or more babies with slow or no heart rate, we would probably end up keeping her rested, doing some blood work, and keeping a very close eye on her. If this had happened towards the end of her pregnancy when she's full term, we would want to induce labor or maybe even do a C-section.
Helen Woodward Animal Center does a remarkable job of matching orphaned pets with loving homes. In fact, the commitment is so strong that sometimes animals are lovingly cared for months before they're adopted. This is one such story. Bubba, whose name was changed to Scout to make him more adoptable, spent 3 years at the center. Finally, a center volunteer, Marianne Houtman, decided it was time Bubba Scout, who she called Bo, had a real home.
Bo Bubba Scout happened to become mine because I felt that Bobo Bubba could not stay here in the shelter one more day. I had been watching him on the internet through this Helen Woodward Animal Site. I had been volunteering here, and every time I logged onto the site at night when I would be at home, quietly watching television and just scanning the internet with my right hand and petting my other dog with the left, his face just kept coming back as he's been here 3 years, and the caption always read, "He has to be home by 4th of July. He has to be home by Thanksgiving."
Marianne wanted Bubba adopted, but she already had a dog. She was willing to pay the adoption fee and the cost of training and medical care for someone else to adopt him.
If someone wants to adopt him, I'll pay them because I just can't handle another dog at this time. So, it's okay, sweetie. So it didn't happen. No one adopted him. They had another special on him with a television, and no one took him. And it was breaking my heart.
Marianne took Bubba.
I love him.
Her 2 dogs learned to get along just fine, and Marianne gained a new appreciation for Helen Woodward Animal Center.
And so since I adopted him, I have a different sense of Helen Woodward and what they do here, even though I volunteered and been involved here for years. It was just this different level of understanding of what they do here. And he was just meant to be my dog.
And when Bubba, Scout, Bo, or whatever you'd like to call him, became Marianne's dog, this woman figured it might be time to retire.
Did you eat your food? Huh?
J.J. Simoneau gave her heart and a lot of attention to Bubba for those 3 years. When he left, she thought it might be the right time for her to leave as well. She couldn't do it.
I do it for the dogs, to see they're the ones that it's for, not me. I don't. It's them. My whole world is around animals. But like Bubba, when Bubba went home, that was, when I saw him today, it just brought tears to my eyes because I was very close to him and he'd been here so long. And then for him to go home was a good thing, but then I lost one of my babies too.
The love is obvious as J.J. cares for a puppy which hasn't been eating. But where does all that love come from?
All of us had our animals when we were young, and that's where we could go to show our love to. And when we were angry or when we were mad, we could hold them and kiss them and tell them that I don't like my mother or I'm upset with her or whatever. And they didn't care. They still licked you, they still kissed you and hugged you, and that was okay. So you can't do that with people.
People helping animals, animals helping people. Once you've met JJ and Marianne and Bubba, it becomes much more than a simple slogan. At Helen Woodward Animal Center, it is a way of life.
As we all know, pets cannot survive without the human touch. Polly is part of a 14-dog family belonging to Rick Pittman, a San Diego breeder.
I received my first Australian Shepherd in 1965 when I was 12 years old. My aunt and uncle had a litter of puppies, and they had a son my age, and we were good friends. And I was there and fell in love with one of the puppies, and the puppy fell in love with me, and my aunt and uncle gave her to me. And that began my trek with Australian Shepherds, and it's now been 38 years and 9 generations later from her, and I still have the same line, and I've owned every female for those 8 generations from birth until they passed away.
Hi, Rick. Thanks for joining us. We all want to know if Polly's ultrasound was accurate. How many puppies did she end up having?
Polly actually had 2 puppies. The ultrasound indicated 2, possibly 3, but 2 was correct. Unfortunately, one of the puppies was considerably smaller and did not survive, so she has 1 healthy puppy.
Well, and that's a perfect example of what ultrasound is for. On the exam, we guessed there were 3, 1 more, 1 less potentially. We did note that there was 1 smaller puppy, which at that time was doing well. But as for number, X-rays are definitely a better way to assess how many puppies are in there.
So you don't actually always ever know, just don't know what the outcome can always be. But thank God you have 1 healthy puppy. And let's take a look at her right now.
Okay.
She's so cute, Rick. Do you think someday you'll be able to show her?
Oh, I certainly hope so. Looking at her right now, you mainly have to look at markings and an educated guess as a breeder and judge. But she's an awfully nice puppy, and I'm hoping she will make a nice show dog for me.
Well, that's great news. Happy to hear that. So, Avi, can you tell everybody out there, all these animal lovers, what they can do to make sure that when the dogs are pregnant, they have the proper health care and nutrition? You know, what should dog owners and people who love dogs do to keep their dogs and animals healthy?
Well, pet nutrition is very important during pregnancy. During the first 6 weeks, you should actually keep the amount of food that the dog gets at a normal amount, and you want to make sure it's a high quality diet. As you get closer to the last 3 weeks of pregnancy, you want to gradually increase the amount of food to about 1.5 times that dog's normal caloric intake. It might be important in some cases to make sure that you feed several smaller meals, because as the puppies grow in the abdomen, they can push on the stomach and therefore decrease the stomach's capacity. The dog may not be able to eat as much, it may be harder to get as many calories in.
So what is an average weight gain for a dog? Is there an average, or does it really vary from very little depending on the size of the dog or the gender of the dog?
It can vary quite a bit. You have some dogs that really don't show that much until their final couple weeks of pregnancy, and you can have other dogs that look like they're ready to explode at any moment. But there's really no average percent of weight gain that I could tell you. People who breed generally know, and breeders have different tips that other people may find useful as well. So what do you do, Rick?
Actually, it's funny you should say that, because many of the breeders that I know, and for many years, we use raspberry leaves. We actually put it on their food. It's felt that a pregnant female, we give them the raspberry leaves, and it actually can be bought in a health food store, and it says on the bottle it's used for like an astringent, and it tends to let the mothers, they have their puppies in a shorter time span and seem to have an easier delivery. So wives' tale or not, we use it, and hopefully we try to do whatever we can to help the mother have an easy time.
Well, I want to thank you both for joining us on the show. And I want to thank Del Mar TV Foundation for all their help in making this show possible. Pets and Vets is an animal health care show providing you with information and tips about animal health care. And I hope you'll join us next time as we do another show bringing you more health care procedures and techniques. Hope to see you all then.
Pets and Vets is made possible by the generous contributions of the Del Mar TV Foundation and the cast and crew who donated their time and energies to help us complete this program. We'd also like to offer our special thanks to Dr. Roseanne Brown and the staff at the Rancho San Diego Animal Hospital for allowing us to shoot this program at their facilities, Rick Pittman and his band of Australian Shepherds, especially Polly, who graciously submitted to her first ultrasound treatment, and the Metronome Corporation for providing us with technical expertise on our field shots and during our editing process. Pets and Vets is interested in your ideas for future shows in veterinary medicine and animal healthcare practices, including alternative medicine. If you have an idea you'd like to share, or if you're an animal practitioner who's interested in being on our show, please be sure to contact us at Del Mar TV, 858-481-2882. Thanks again for joining us on Pets and Vets. Hi, I'm Cher Sauer, co-producer and director of Pets and Vets. In this episode, you met Polly, who's a champion Australian Shepherd with an arm-long list of people waiting to welcome her puppies into their homes. But for most pregnant animals, this is simply not the case. Every year, thousands of animals are euthanized in facilities across the country simply because they are unwanted. And sadly, many of these are just babies, puppies, and kittens. Now, in Polly's case, she had just one healthy puppy, but dogs can deliver 4, 5, or even 10 puppies in just one litter. That's up to 10 puppies that may not be able to find a home. Don't let your puppies end up in a facility waiting for death rather than waiting for someone to welcome them home. Please spay and neuter your pets. It's a very simple procedure, and many veterinary clinics and facilities offer discounts to allow you to afford it. Thanks again for joining us at Pets and Vets.